Hey, everybody, welcome to the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. We have a special guest this week. And as with all our guests, Emina gets the pleasure of introducing Emina.
That is not always the case, but I do have the pleasure today of introducing to our listeners Laura Ehrich, the Vice President of Public Policy at the New York State Healthcare Providers Association. Laura, thank you so much for being here today with us. We're in the midst of a very busy budget season. I don't know if it's necessarily busy for home care generally. CDPAP is getting a lot of attention, but that is not the full extent of home care. But please tell us kind of what the priorities are for HCP and what you're hoping to accomplish through this budget season.
Sure, Sasha and Amina, it's so great to see you, and I very much appreciate the opportunity to talk to your audience. I'm passionate about home care and I'm passionate about politics and good public policy. So this is, the fight of our lives here in home care. So yes, there's a lot happening in consumer directed, but that is, a fraction of all of the home care that's available here in New York. So for the New York State Association of Healthcare Providers, or HCP, we represent primarily licensed home care services agencies around the state. And so our primary focus running into the state budget is that we get some adequate funding to keep these providers going. I think since the last Cuomo administration, maybe the start of the last Cuomo administration, there hasn't been any significant investment in home care. We're hoping that Governor Hochul and our state legislative leaders can make a difference.
We were speaking about the hospitals on our last podcast and how they seem to get all the funding, and uh, this budget there's a cap on the spending, but I would assume they're going to get bailed out. But yeah, I mean, we're not even on. There's no plan for us, right? It's this advocacy that's important, and I'd like to kind of speak to that a bit, right? The importance of the associations and what they do, what your association is, who the target membership is, right? Because I think your association is a bit different than others, and I think that distinction is important. So could you speak to that?
Yeah, sure. So, as I said, HCP represents primarily licensed home care services agencies, but there's also certified agencies out there who provide post acute care. There are programs like Consumer Directed that provide some of the home care services. There's hospice for folks who are in the last stages of their lives. There's programs like the Nursing Home Transition and Diversion Waiver. All of that is part of the home care landscape. At HCP, we're really focused on licensed agencies. These are folks who are sending home health aides, personal care aides out to people's homes. They're usually folks who are aging in place in their communities. And a lot of them are served through the state safety net program, through Medicaid. That's why the state budget process is so important and why our advocacy work on behalf of our members, on behalf of licensed agencies, is so critical. There's so many changes happening at the federal level. And when we're talking about Medicaid, of course, we're talking about that federal state partnership. So we're raising our voices as much as we can. You mentioned hospitals. Of course, we love hospitals. Hospitals are real easy to invest in. People understand hospitals. But we've got this managed care organization tax out there that's supposed to be bringing an influx of money into the state coffers. We would love to see some of that in home care. I saw that Governor Hochul's executive budget proposal certainly included hospitals, it included nursing homes, but we're fighting to keep people out of those institutions. We want to make sure that folks can stay at home and in their communities. So we're looking for $150 million from that MCO tax to help bring home care up to the same level as other sectors in the healthcare spectrum.
So I wanted to address some of the legislative priorities that your association will be addressing and has been addressing. I know you have advocacy day coming up. You have other meetings that you're constantly in Albany and in the Capitol having. So what I have on my list is the fair and transparent reimbursement, the stability and oversight in consumer directed care, and increased transparency in managed long-term care, right? And if I'm missing any and you want to add, but I think we can go into those priorities and how you're addressing them and advocating on behalf of the industry.
Sure. So right off the bat, for home care, we're looking for that investment. I think most business owners in the state know that all of those operational expenses are astronomical. It's certainly the same in home care. I don't think a lot of folks in the state know that home care agencies have to have a building, they have to have staff. It's not just a phone line that's sending out workers magically. There's a lot of training. So, again, we need that investment. We've been withering on the vine for too many years. We talked about accountability and transparency, and that has been a theme in our advocacy work here at HCP for at least a couple of years now. I think that managed care plans that are helping to manage the care of hundreds of thousands of New Yorkers are not always transparent in how they reimburse home care providers. So the state will send its money to the managed care plans. The managed care plans then reimburse providers for the care that they have provided. And too frequently, those reimbursements don't even meet the minimum wage requirements, much less all of the other statutory things that providers are required to pay for, things like taxes and unemployment, pay for training. So it would be fantastic if there could be some transparency around what that reimbursement rate is supposed to include. It would also be fantastic if there was a formula that everybody understood for how to get to those rates. So right now, we have Assembly Bill 1112, which is sponsored by Assembly Health Chair Amy Paulin. It's been sponsored on the Senate side by the Senate Health Chair Gustavo Rivera. And that would help to set regional base reimbursement rates. I think that is absolutely critical. We have worker wage parity areas, we have non-worker wage parity areas. There's a lot of regional differences. And if we could just get a regional base rate, I think it would bring some really some important added stability and transparency and clarity to the process.
And I'm guessing because it will be legislated into law, then this would supersede the conversations or the ideas of the Department of Health that, hey, you guys have a private contract and we're not going to get involved, right? That's their common refrain. So the objective of this bill or law hopefully would address that, correct?
Yeah, absolutely. One of the things that we have found with the Department of Health is, they've contracted with managed care plans in part to, again, manage care. It's something that the department has delegated elsewhere. The reality, though, is that the department has, really relied on the fact that they don't have any insight into those private relationships, into those negotiations between insurance companies and provider agencies. A couple of years ago, we were talking to the Department of Health, and they said they didn't really understand the entire rate setting and reimbursement process. So we were able to go to our members and say, if you could share with us what your rates are plan by plan, we could help share that information with the Department of Health. And that's one of the roles of the association, is to share information from providers to the department. I think they were astonished at just how low some of those rates were. I was certainly astonished. Sadly, we haven't seen a lot of improvement, though. The bill that I was mentioning is very closely tied to what a lot of folks may remember as fair pay for home care, where we had talked about raising wages and raising reimbursements in a commensurate way. Legislators rose wages, but sadly, they did not include increased investments. They did not include increasing reimbursements. So part of the fix is this legislation. We're really hoping it moves this year.
Laura, that was very helpful, and I'm in support of a lot of these initiatives. I hope that this year we can actually make some progress on this. I know reimbursement transparency and some sort of a minimum floor has been long an initiative of the home care industry, and it has never quite made it through. I suspect it's because of the heavy lobby efforts on the plan association side, but are you able to comment on that at all? Like, why something that seems to be so logical, well-intentioned, needed, and clear-cut, why something like that has never actually made it into law? despite every year us trying to get something on the books in that regard.
Yeah, it's challenging and it's frustrating. I don't want to throw any other industry under the bus. I don't think that's fair. We all are doing our jobs, supporting the people that we represent. But I think at the end of the day, the people who are really suffering are consumers, people who are trying to get care to stay in their homes and communities, who are fighting against institutionalization. I don't think any of us have the dream of retiring to a skilled nursing facility. Um, they're great when they're needed, but that doesn't help keep our elders in their homes and communities. I think there's, to answer your question more directly, I think there's some baked in ageism when it comes to state budget setting. It's very easy to look at children and families and education as an investment. But when we're talking about the aging population, when we're talking about people who are disadvantaged economically, when we're talking about workers who are primarily Black and Brown women, often from immigrant communities, it's easier to paint our industry as an expense in the state budget rather than an opportunity for investment. We see it completely differently. We're looking at investments in Medicaid as a way to save Medicaid dollars in the longer term. We know that if we increase reimbursements, we can pay people a little bit better. We can do some innovative things that will help lessen the administrative burden. We know that home care is significantly less expensive than some of those more institutionalized settings. And not for nothing, it's where people want to be. Again, we want to stay in our homes and communities. That's really important to me. I don't want to live in a neighborhood that's full of people who are just under age 50. Are there lots of competing interests out there? Absolutely. But folks who are aging, folks who are disabled are absolutely critical parts of our communities, and we need to fight to keep them there.
You said some keywords there, or alluded to keywords or topics around immigration, underserved communities in need. And these are topics being discussed at the federal level. Obviously has effects at the, and you're a state agency, though you may collaborate within the state and federal, but what are the impacts that you're seeing at the state level from policies and things at the federal level, and how are you collaborating to advocate for that at the national level?
Yeah, this is, sort of the agony and the ecstasy, right? So, we have a robust partnership in the state between associations and organizations that have common cause. So, as home care providers, we are partnering with organizations like Medicaid Matters, like 1199, like the Centers for Elder Law and Justice, to have a cohesive voice and to speak with one voice when we're reaching out to our federal elected officials. I think over the last couple of weeks, we've seen how much chaos there is at the federal level. Within a few days of the new presidential administration coming in, we were sort of blindsided by states not being able to access the Medicaid payment portal. Fortunately, home care providers were not impacted, but when states can't get access to that portal, it causes a lot of panic. I think, too, the congressional budget bills that have been floated either ignores Medicaid as it does in the Senate bill, or in the House bill, it proposes massive cuts to the Medicaid program. That would be absolutely devastating to a state like New York, where our communities are so dependent on those Medicaid dollars to keep people healthy and safe at home. I'll also say one of the other less direct impacts of the change in administration is around immigration policy. We at HCP have not taken a position on immigration policy. However, we are hearing from our members, especially those who are in large metropolitan areas like New York City, that there's a lot of fear and a lot of bad information out there for workers who may be coming from immigrant communities, or who may be serving families who come from immigrant communities. The fear of having ICE show up on your door, or to be at somebody's house providing care, and to have some sort of immigration action happening is challenging. And it just adds a layer of chaos to everything that's happening in home care right now.
Yeah, I mean, I think on that front, we had a influx with the Biden administration's special permissions that he gave to immigrants from, whether it was Haiti, whether it was Venezuela, I think Ukraine was included, and some others. That was recently rescinded, I believe, right? So this influx of staff that would have gravitated to home care, you're going to lose that possibly, right? And
Yeah.
that's a significant impact. You already don't have having English speaking aides is one thing that's difficult across the board, and just to have nothing at all, even if somebody could use Google Translator or whatever just to get you by if the patient allows, right? It's not that you can just do that, but you're talking about nothing. We're already suffering. So I don't know the solution, but this isn't it.
Well, I think we're seeing how important all of that cultural competency and diversity is in the workforce, especially looking at some of the changes that are happening in the consumer-directed program. I don't want to get too bogged down into the whole mess that is the consumer-directed program and the consolidation of all of the state's fiscal intermediaries under a single entity. But, one of the promises of this transition was that this new entity would be able to provide in-language care in the same way that the 600 or 700 FIs who are already here in the state can. I was out in Western New York last week. Western New York has a fairly sizable Polish community, and I had heard that there were some problems where PPL did not support Polish language translation. My Spanish isn't fantastic, but I know Spanish is super important here in New York. I've heard anecdotally, at least, that people are calling looking for Spanish language translation, and they're getting transferred to somebody who might speak Italian, which is close, but it's not exactly the same. And then earlier today, apparently PPL was out doing some outreach that was targeted to a Spanish speaking audience, and the materials that they brought were all in English. And that's, sadly something that we're seeing across the board. I think those of us who have been in New York for a while understand that, even if we grew up in households where English was the primary language being spoken, that's certainly not the case across the board. And I think especially for people who are maybe newly here in this country, having access to language, in language materials, and especially when it comes to healthcare, it's so critical. It's so critical. So I'm concerned that we're not going to have the workforce that we need, whether it's in consumer directed or on the licensed agency side of things. But I guess we'll have to wait and see what is actually implemented, versus what's been promised.
I wonder if these stories are having an impact on the legislators, because the conversation seemed to be fiscal, right? We're going to save X amount, and that's a big number, and we're doing this because of. But these anecdotals, I saw the Polish consumer trying to get through and it taking over an hour and a half, and these are real. These are the things that really impact the community, the patients, and the families who are concerned about them, and I just don't know that it's having an impact because it's a financial discussion or conversation.
Well, and I think the state budget joint legislative hearing earlier this week on the health and Medicaid budget was really telling. And forgive me, I can't remember exactly who asked the questions of whom, but one of the lawmakers asked the Department of Health, even if this doesn't save the amount of money that it's intended to, are you still going to move forward with this? And their answer was an unequivocal yes. So let's put to bed right now any argument that this is about money. I don't think it's about money. I look at it from a consumer perspective. At the end of the day, while I understand that the state has a responsibility to manage its costs and to manage enrollment in this program, the number of people who need care doesn't change. Whether they're getting the care through the consumer-directed program or through a licensed agency, they still need care. it's frustrating when the argument is financial, but the ramifications are very real on families and on our communities and loved ones.
And I'm just gonna throw this out there. This is a rumor, right? But it may add color to this conversation that we're having, or continue this along the lines of what we're talking about right now, where I'm starting to hear that the MLTCs are starting to see the negative impacts of this transition in their business model, right? Where their active participation or cooperation in transitioning may be impacted, right? Because not only is transitioning to PPL and they're possibly asking for a higher reimbursement rate going to have a direct impact, but when you have a single entity taking care of this and they're so large, why doesn't PPL just ask for direct payment to Medicaid, or they'll take over the management or administration, and there goes the need for the MLTC. So I think they're starting to have some of this realization, and just because your name wasn't on the bill name, but you're going to be affected, impacted, because you're part of the food chain, right? You're above us as a providers, but what happens below does sometimes trickle up.
Yeah, I mean, I hate to try to speak for the managed long-term care plans. I think they have their own roles and agendas, which of course they should. But I've heard the same rumors. I've heard that PPL is going to those managed care plans and asking for cash up front. So it's a disturbing situation. But I will add that I think there is potentially a legislative solution out there, and it's something that HCP has been supporting. There's a bill out there right now. It's been again sponsored by Senator Gustavo Rivera, and it's carried upstate by Al Sturpey from the Syracuse area. And this would repeal that single statewide FI. It would repeal that entire request for proposals process. And instead of going to, a questionable bidding process, this would put in place a licensure process, which gives the Department of Health, which gives the state the accountability that it wants. It gives it the oversight that it needs, and it will give it some insight into what's going on with this program. So we're really hoping that moves this year. I think it's important. We're looking at a couple of months now until this consolidation under an FI is done. And as I'm watching our members who are struggling, who have, maybe some fiscal intermediary business as part of their entire book of business, the chaos that's out there is almost as painful as the threat of closure to all of these businesses. I think during the budget hearing that I spoke about earlier, we heard Assemblywoman Paulin, a number of other people ask the department, what's going to happen if this doesn't work, right? If we can't get everybody transitioned to this new vendor, what's the fallback plan? What's plan B? And at the time, it sounded like the Department of Health was, sure that everything's moving ahead the way that it should be. But I think we're starting to see that there are some huge problems when it comes to moving this number of patients and their workers to a new vendor. They've only got a few short weeks to finish moving the majority of people in the program, and it does not seem to be going well. So I do hope that, between the legislative solution and, a common sense approach that would include slowing this process down a little bit, I think, we may see some breathing room, but we can't take our foot off the pedal at this point. We've got to really move that bill forward and to continue having consumers from that consumer-directed program talk to their lawmakers and help them understand just how much of a mess this thing is right now. So we just talked about a lot of priorities in the state budget process. And before I move off of Medicaid, which is certainly the biggest payer of home care here in the state. I just want to recap a little bit because there's so much happening in Albany right now. So again, our priority is always going to be getting funding for home care providers. It's critical. They haven't seen a reimbursement rate increase in forever. And they're barely keeping their noses above water. So for sure, we need $150 million from that MCO tax. We also need to repeal the fiscal intermediary bill and get something else in place. Some licensure would be phenomenal instead of this mess that we have right now. We're looking at reimbursement rates in managed long-term care plans. We have to make sure that those reimbursement rates are set at a predictable and transparent level. We have to make sure that there is increased transparency and accountability so that the department is reporting to consumers and to advocates about the managed long-term care plans. And I neglected to say that we need to reject the governor's proposal to cap enrollment in the nursing home transition and diversion waiver. So, most people know that New York is fairly generous when it comes to Medicaid. Waivers are a way for the state to offer programs within Medicaid that aren't part of the core benefit. And our state saw value in helping to empower people who are either in a nursing home or who are imminently going into a nursing home, who might be able to stay home with some additional supports through this waiver, the nursing home transition and diversion waiver, or the NHTD waiver. The governor has, understandably, I think, sought to rein in enrollment and costs. But I think that is a penny wise and pound foolish approach. We know that keeping people out of nursing homes when there is a good alternative is far less expensive and more desirable. So capping enrollment is not a fantastic idea. We hope that the legislature is able to get rid of that when they come out with their one house bills.
Laura, let me just jump in here because you covered a lot of ground, and I do want to just cover a few of those things. There's a lot there to unpack, actually. As far as Medicaid, I was at the hearing on Tuesday, the majority of the day. Unfortunately, I had to leave before you testified. But there was this idea from the Medicaid director that the Medicaid spending gap can be closed solely through this CDPAP consolidation. And I feel like he was scrambling for an answer. Rivera was pressing him on. Actually, I don't think it was Rivera. It was another senator. I think probably a more Republican-minded senator who was initially starting out the questioning about what about all of these healthcare and Medicaid expenses that we have allocated to undocumented individuals or individuals that the Department of Health has not been able to confirm that they are entitled to Medicaid. And he did some smart numbers, right? He said that over the majority of Medicaid enrollees, the DOH has been able to confirm, are entitled to Medicaid still. But there are about a million people, and it costs $10,000, I believe, a month for their Medicaid expenses that the state has still not been able to confirm are entitled to Medicaid. And that's how the question started, but ended with Medicaid costs are huge. How are you going to stop them? And the Medicaid director's answer was consolidation. What do you think of this idea that they can achieve so much strictly by this one move? I think that's a lot of pressure on this one program succeeding.
Yeah, and let's remember, this is a program that covers 250,000 people. That's certainly not the entirety of the Medicaid population. Putting math aside, I think my head goes to people need care. I hate to wear the humanitarian hat, but I think about people who are getting health care, home care through Medicaid. Whether or not they're here legally, they still need the care. To me, that's the bottom line. The state has within its control enrollment in different programs. It has within its control the ability to set parameters about who's eligible for what. But I think, whoever needs care needs that care regardless of who the payer is. These are arguments that have been around forever. Personally, I think healthcare is a human right. Do we need to pay for it? Sure. Do we need to be good stewards of our public dollars? Absolutely. But not providing care, not giving people the health care that they need puts all of us at risk.
Well, so along those lines, right? Because the fiscally minded voices will continue to be present and ask these types of questions. The state continues to suffer from a smaller and smaller tax base, right? When you look at the bigger picture, some of the other policies that the state is making are not exactly making it easier for people to live here, are giving businesses incentives to hire people in other states. There's no doubt that the talent pool is shrinking everywhere, not just in New York. And so with people being able to work remotely, it's only natural that that base of workers, of income tax, et cetera, is coming from different states and staying there, not New York. So we have these rising costs and a reduced tax base. I think this will continue to be a big question. And it can't be just home care, which is not remembered when it's time to hand out money, but it's always mentioned when it's time to blame someone for the expenses. What do you think of the federal government bringing an action? I don't know if you saw that U.S. Department of Justice announcement that they have filed a lawsuit against Letitia James, the DMV commissioner, Governor Hochul, supposedly for interference with federal immigration laws. I mean, do you think that's a prelude to there being more federal action to control what New York is doing within its borders and possibly with healthcare as well?
I mean, I think that's well beyond the scope of my expertise when it comes to like federal law. I'm not an expert in federal or constitutional law, but I read history pretty well. And, when I think about the presidency, regardless of who's sitting there,
Mhm.
historically, when there's a change in administration, one of the first things that happens, from a 10,000-foot view, is there's some testing about what are the limits, what are the parameters of presidential power? Where is the division between federal and state law? I think that's what we're seeing play out here. Is the Trump administration is looking to see where the limits of its power actually lie. Governor Hochul and her administration are very firmly asserting that there are state laws that give New York part of its own flavor. Um, and, I don't know what's going to happen, but I do think that chaos is tough for everybody.
Well, so fair enough. Sorry, I didn't mean to put you on the spot with necessarily a constitutional question, but speaking of this action and these questions about, illegal immigrants maybe taking up the resources, already limited resources of Medicaid funding, I just don't think it's a far stretch for the Trump administration to say, you, New York State, have wasted all this money on Medicaid that you supposedly cannot provide to your lawful citizens because you've been spending it on these people who may be here illegally. It would not be a far stretch if they have brought the U.S. Department of Justice to bring these types of actions. I could see that being an extension, honestly, an argument. There are U.S. New York residents who cannot get Medicaid assistance because you've wasted this money on illegal immigrants. And a portion of Medicaid is federal fund, right? New York federal government does have reach and quote jurisdiction over those funds as well to make this argument. So I don't know. It's an interesting world, interesting idea. I don't say that because it's mine, but I was really surprised to see that action with respect to immigration generally, and it just got me thinking if the Trump administration is going in this direction, they could go in 1,000 different ways that affects healthcare, including CDPAP. So going back to CDPAP, I just want to ask your opinion about the likelihood of federal intervention in this PPL transition. There are a lot of providers who have different bases of hope that the single FI will not go forward. But one of them is that Trump will issue some sort of an executive order or some sort of federal action against Hochul and her administration to put this single FI on hold. Is there any shred of indication this might be happening?
I think it's impossible to predict what this administration is going to do. Some of the things that it has talked about are more specific to the managed care organization tax. I think reining that back in is certainly something that the Trump administration has said it would be interested in doing. Whether it's closing the loopholes that allow us to get those taxes, or if it's making those taxes smaller over a couple of years to sort of wean states like California and New York off of that tax. But when it comes to consumer directed and whether or not the federal government is going to weigh in or is going to go after Governor Hochul, I don't have a crystal ball. When we're talking about immigration and we're talking about, scarce public dollars, there's always a boogeyman when it comes to Medicaid, whether it's undocumented folks, or whether it's waste, fraud, and abuse. Show me the numbers. And I think this is the challenge when it comes to transparency is, it's hard to have insight into where the problems in the system are when we're hamstrung by not having access to publicly available data. So that's challenging. What I do know is that home care is a phenomenal cost savings within the Medicaid program. We deliver the care that people want, we deliver better healthcare outcomes, and we do it more efficiently than any other sector in the healthcare spectrum.
So the idea of Trump stepping in is a bit complex and it's contradictory to what's happening with Doge, right? Doge is out here looking for savings, but what I understand with these detention camps and even expansions of federal prisons because of law and order and what have you, these are private companies who are getting paid by federal dollars and state dollars. So which is supported by the administration, whether it's just for businesses or for law and order. So I don't think that because it's Medicaid money, necessarily the Trump administration or Republicans won't support. So I think there could be a possibility if the right people are able to get in front of him for them to convince him that this is something to fight for and to put it in the light what along the lines of what you were saying, Emina, right? The New Yorkers not getting services in lieu of undocumented, which is his go-to. So, we need to find that right person that can get in front of to advocate for the industry.
I think one of the arguments to be made here is, the fiscal intermediary consolidation is a lot of interference in the economy, right? Like you would expect that a robust marketplace of providers, 600 or 700 fiscal intermediaries, those are small businesses, that are in the community, in legislators' districts. They're paying workers, they're fantastic businesses. Some of them are maybe not so fantastic, and market forces should be able to help achieve that consolidation, not the heavy hand of government coming in to say we need this out of state actor to meddle in consumer directed. There's so much that's involved, on the political side of things with Medicaid dollars. And we could talk about immigration, we could talk about partisanship, we could talk about, waste, fraud, and abuse, but it does not change the reality that for New Yorkers who are aging at an astronomical rate, and that's a good thing, right? We all want to age. In order to stay in homes and communities, folks need care. And at the end of the day, the bottom line, I don't think it matters what party you're in or what you think of immigration or whether or not you have a small business frame of mind when you're thinking about programs. Our aging neighbors, our family members, our loved ones want to stay in their homes and communities. And that's what we should be empowering them to do. Home care has that opportunity because we do it effectively, we do it efficiently. We are the smart investment. So moving on from all things Medicaid, there was actually a bright spot in the governor's executive budget proposal. She included an investment of $45 million to the State Office for Aging. And so this is separate. This is not Medicaid money. This is, not Department of Health. This is a completely different budget line, different department within the state. This would help end waiting lists for home care services. I would hate to paint home care as a Medicaid only operation. It's not. There's lots of fantastic programs that are operated through the State Office for Aging that also helps keep people in their homes and communities and off the Medicaid rolls by giving them just a little bit of help and helping them, age successfully in community.
How would that work? Can you talk a little bit about that proposal? I don't think I saw that or appreciated that would be accomplished through this. Can you just talk a little bit in more granular level of what this is?
Sure. So one of the programs that is funded through the State Office for Aging is ISEP. It's EISEP, the Expanded In-Home Services for the Elderly program. It's a fantastic way for folks who are not on the Medicaid rolls because they either have too much income or too much assets to get some home care, whether it's a couple of hours a day, whether it's a few days a week. It's just that extra help to stay at home successfully. We're talking about people who may need some help getting their laundry done or who may need help cooking a nutritious meal. It's things like Meals on Wheels. And unfortunately, because funding for these programs has been flat for so many years, most counties have a waiting list of people who are trying to access these services. And year after year during the state budget negotiations, we hear about ISEP, Meals on Wheels, other programs that just need a little bit more money to keep people in their homes and communities. And certainly many of our members at HCP provide ISEP services throughout the state. I think one of the nicest benefits in that program is you get a case manager who helps you navigate what is a very complicated system. And part of the reason the state invests in those State Office for the Aging programs is that it saves Medicaid dollars.
But the actual service itself, and ISEP I've heard of, I do have clients who utilize that service. There's a CDPAP under ISEP as well, right? There's a traditional home care service under ISEP also. At the core, the service is a personal care service. It's just the funding source is different, correct?
Yeah, I don't know on that granular a level whether consumer directed is connected to ISEP, but there are so many different ways for people to access the care that they need. And I think that's something that I want to really impress on not just your listeners, but people around the state is, whether you're caring for an aging loved one or if you yourself are trying to navigate aging in your community, if you're a service provider, there are so many different entry points to get the help that you need. And early care, early intervention is just as important for aging as it is on the child side of things. Getting care early means that you may not have to wait for a crisis that's going to be expensive and that might land you in a nursing home.
Okay, Laura. And so I don't want to hold you up any longer. We've touched on quite a lot of topics. Any parting words as we continue into the budget season, which, as you know from before, it always kind of heats up in the last 2-3 weeks. So even though it seems like there's a lot that people are dealing with and watching every day something new come out, there's actually probably going to be a lot more. So anything you want to impart on our listeners and viewers in view of the fact that their life is probably going to get more exciting before it slows down after the budget?
Yeah, I think the most important thing I would like for your listeners to understand is that they have the ability to make a difference. When it comes to the state budget, it is not necessarily negotiated by 3 people. Those 3 people are informed by lawmakers around the state. if you are not talking to your local senator, if you are not talking to your local assembly member about your business, about the care that you need, about the job that you do, about your experiences as an agency operator, then somebody else is. And you want to be the one to tell your own story and to really impress upon lawmakers that home care isn't just a big amorphous, budget line item. It's a real service that impacts real people. So reach out to your local lawmakers, if for no other reason than to just introduce yourself as a resource in the community. Start building that relationship now.
Thanks a lot, Laura, for all that information. And for our listeners who are not active participants in associations, you see that what level of conversation that we're having and what Laura is sharing and imparting, and the advocacy that they do, especially if you're not advocating on your own. You can advocate as part of an association, learn from the association. They can guide you on how to be a part of the industry and community and work together to effectuate some change. So again, thanks, Emina, as always. Thank you, Laura, for joining us. Thanks for listening to the Home Care Forum podcast with your hosts, Sasha, Guillaume, and Emina Poricanin. Have a good one.